Let's talk about Omicron now. The virus is on the prowl. India is stepping up its preparedness restrictions. 2 days after positive cases were detected in Karnataka, the state is tightening all the guidelines. Events and educational institutes have been postponed till 15th of January next year. People will be allowed into theatres, multiplexes and malls only if they are fully vaccinated. The Karnataka government is also assured that 10 foreigners who have in fact gone missing will be tracked soon. Remember, they arrived from South Africa and they've tested positive. In Rajasthan, 9 members of a family tested positive for COVID after 4 members returned from a trip to South Africa. Samples taken from patients have been sent for genomic sequencing in Jaipur. In Maharashtra, the samples of 30 international passengers have been sent for sequencing as well. Meanwhile, the centre said while there is no evidence to suggest that existing vaccines do not work on the COVID-19 new variant, the 5th variant of concern. Mustafa Sheikh is getting asked more details. Mustafa, good morning. The very fact that there are 30 people, in fact, who are under the radar essentially of health authorities, do give us an idea about the kind of steps that Mumbai and the Maharashtra government essentially is taking to ensure that even if there's a situation of an explosion of cases, things are managed well.
Well, even yesterday, the BMC has come out with strict guidelines for international travelers and their institutional quarantine rules and mechanisms. So, the Mumbai is taking example from the last 2 waves and the cases it reported from there, and they are trying to restrict as much as the spread of virus or the new variant is possible. As you rightly said, there are 13 people in Mumbai whose samples are to be tested by a genome sequencing lab at Kasturba Hospital. We are being told that by tomorrow, Sunday, the reports of these genome sequencing are awaited. Remember, it was the first person from Dombivli who tested positive with a travel history to South Africa. Since then, there have been thousands of tests which have been done on international travelers. Few of the samples have been sent of the positive patients for genome sequencing. So the further strategy of Maharashtra government and BMC really depends on what is the result of those genome sequencings. Back to you.
Mustafa Sheikh, thanks for getting us up to speed with all of those developments.